Good evening. Welcome everyone to the Nashville chapter of the National Association of Black Journalists. And this is our next edition of Crucial Conversations. It's our first live event, so we are pleased and happy that you are here with us. And this crucial conversation will focus on healthcare. This evening, we have three amazing African-American women here in Tennessee who are leading the conversations and shaping the vision with healthcare providers in the state of Tennessee. So let me introduce them to you, and then we will get our conversation going. First, I'd like to introduce Ms. Katina Beard, who is the president of the Board of Directors of the Tennessee Primary Care Association, and also the CEO of the Matthew Walker Health Center in Nashville. Welcome. And I'd like to introduce Dr. Robin Williams, who is a breast surgeon here in Nashville, and she is also president of the Nashville Academy of Medicine. And I'd also like to introduce Dr. Alicia Hall, who is a family medicine physician, and she is president of Tennessee Women in Medicine. Welcome, welcome. And let's get our conversation rolling. First, I'd like to say all three of you are graduates of Meharry Medical College. So you have all of that in common, but all three of you have been working very hard this year in 2020. We're almost 8 months into a pandemic. We are facing an economic downturn, and there is lots of stress over social justice issues, as well as a very contentious presidential election. So first of all, I'd like you all to talk a little bit about the organizations that you lead, and then we'll go into how they have been affected by what's going on in 2020. And Dr. Williams, I'm going to ask you to go first.
Okay, thank you for having me. It's nice to be here this evening. First, I'd like to say I'm actually a graduate of University of Maryland School of Medicine. I served as a professor at Meharry Medical College, but no, definitely affiliated. I served as an assistant professor there. So there we go. I am the current president of the Nashville Academy of Medicine. We are the oldest medical society in Tennessee, founded in 1821. We're coming up on our 200th anniversary next year. We're really excited about that and looking forward to all the celebrations associated with that. We are an organization of over 2,300 members that range from medical students all the way to retired physicians. And our focus is physician health, practice health, as well as community health. And we offer opportunities to our members through leadership, education, and advocacy.
And Ms. Beard, you go next.
Hello, thank you for having me tonight. I am excited for this conversation to be happening. As you said in the introduction, I am the president of the board of directors for the Tennessee Primary Care Association, and we are a member organization that represents 32 federally qualified health centers across the state of Tennessee, which represents 211 health center sites. And we are serving, I believe, just a bit over 179,000 patients across the state. And so we represent both rural and urban health centers, and the Tennessee Primary Care Association itself is led by a 14-member board. And our role with the Tennessee Primary Care Association, and the overall role of the Tennessee Primary Care Association, is to be the voice of advocacy and provide technical assistance in terms of leadership and quality programs for community health centers to fulfill their individual missions and fulfill the role as a federally qualified health center.
Okay. And Dr. Hall. Okay. You are muted, Dr. Hall. Still can't hear you. Uh-oh. You look unmuted. Well, Dr. Hall, we'll come back to you in a moment. And the first question I wanted to ask, I'd like to know, what are the physicians, medical providers in your organizations saying about how they've been affected by the pandemic? And Dr. Williams, could you start for me, please?
Well, initially, because of the pandemic, a lot of us had to alter our office hours. And so some of us initially were actually had to close our offices down or convert completely over to telemedicine. That certainly had been a significant impact initially. Others that were still open had reduced their office hours or services. And over time, we did begin to reopen. Some patients were reluctant to come in initially, but I think we're beginning to see that more and more patients are beginning to come forward for those exams and for those screening services that they need.
Okay. All right, Dr. Hall, it looks like you maybe
Yes.
unmuted now. Great.
Can you hear me now?
Yes, we can hear you.
Okay. Well, love technology, and at the same time, it can be a challenge. But I just want to thank you all for having me, along with Dr. Williams and Ms. Beard. Again, I'm Dr. Hall, board certified family physician for 20 years and practiced for 20 years, and a physician entrepreneur. And I'm the president of Tennessee Women in Medicine. And we're primarily an organization of women physicians, but we also have clinical psychologists and dentists as part of our membership as well. And we've been in existence since 1992. Started with 10 charter members, but have grown to hundreds of members since that time. The purpose of our organization is to meet, grow, and learn together. We provide professional networking as well as moral support and opportunities for growth and leadership in our various respective fields of medicine. We actually represent 38 disciplines of different fields of medicine. And so it's an awesome opportunity for women healthcare professionals to come together to, again, meet, grow, and learn together. So thank you.
All right, well, thank you. And what have been the main concerns of the women in your organization? What have you heard during this pandemic?
Yes, well, it has been a challenging time for medical practices, healthcare facilities. The burden when we initially started with the pandemic was, everything was so new. And so it's historic, and we kind of learn as events unfold, if you will. And so initially there were concerns of safety. There was a national shortage of PPE, protective personal equipment, and making sure that we could safely provide the care that was needed for patients. Thankfully, that's not as big of an issue now that a lot of companies have come in and provided the necessary equipment that we need in order to serve patients. And then, of course, the fear of the unknown, again, with this being new, a lot of patients being afraid to even come to a physician's office. So we've had to adjust in medicine with the times, and thank God for virtual technology to learn about telehealth, telemedicine. That's been a big part of a lot of medical practices, specialists and primary care physicians alike. And I'm proud to say that with the Tennessee Women in Medicine, we were having informational seminars on telehealth and telemedicine prior to the pandemic beginning, like a year prior. And I'm one of the younger members in the organization, so I was making sure that we headed up with the advancements as far as technology and medicine. And, you know, it has come into place because now, you know, we cannot operate without telehealth and telemedicine in a pandemic. So
Sounds like it.
yes,
So that,
advancing with the times has been one of the biggest concerns, to make sure we can accommodate our field, what we do, and providing safety and convenience for patients as well.
okay. And Ms. Beard, with the federally funded community health centers, what has been the biggest issue facing the medical providers?
Sure. So much like Dr. Hall spoke of, our challenge has also been access to PPE. Initially, I think all of the health centers had a significant challenge in accessing PPE and making sure that our staff were safe. And so I think across the state, our members, our health centers were very concerned about the ability to address this pandemic while continuing to treat a largely uninsured population, because that is the target population of community health centers, is to make sure there is access for people who are uninsured or underinsured. And so I don't believe that there was a health center across the state that actually closed. I do believe many of us modified our hours, but went with a 1 week on, 1 week off shift for staff to make sure that they would always have staff available. Telemedicine has not been an easy climb for many health centers because of technology challenges, the digital divide in rural communities, challenges with older populations accessing telehealth. And so for our health center, Matthew Walker Health Center, a significant number of our patients are older or low income, and so they didn't have the type of technology that was useful for telemedicine. And so for the first couple of weeks, we saw a decline in our patient population, but probably into the third or fourth week, our numbers started to increase because patients needed to come in. And so we really focused on, and I think across the state, this is true, that we focused on those critical patients that could easily end up in the emergency department without medication management or continued access to treatment. And so we saw ourselves as truly a gatekeeper in this time to make sure that patients that did not need to be in the hospital did not end up there. And so that's really, I think, the goal across the state and the members of the organization.
So the pandemic started, I think everybody sort of shut down middle of March. I mean, when you really started to feel the effects of it. And all of you have said you've seen the number of patients coming in go down, but it's slowly starting to go back up at this point, even though COVID numbers are still surging in Tennessee, especially in the Nashville area now.
I would say for our medical services, yes, those numbers have started to rebound a bit. But dental programs across the state are still struggling because of the high risk of transmission due to the aerosol producing procedures. And so dental clinics have really struggled to kind of really get back to the level of volume pre-pandemic because of course we all want to be careful. We want our staff to be safe. We want the patient to be safe and where I think, and I know Dr. Hall and Dr. Williams will definitely correct me, but where we need the highest level of PPE we found is in the dental clinic. And with the shortages that were abound, we really had to be very careful in terms of who and what type of dental services we would provide. And so I think what we would find across the state is that medical services are starting to come back, behavioral health services. Those were, for us, the #1 visits that really could switch quickly to telemedicine. And we saw an increase in those numbers initially, but the dental numbers are been pretty low since the beginning of the pandemic.
Okay. Dr. Williams, Dr. Hall, what have you seen?
Yes, I can say that healthcare professionals and the the physicians and healthcare professionals are catching on. I'm glad that insurance companies are now finally catching on to covering the services that are needed in the area of telehealth. They used to cover it, but it was very limited to people in rural, remote areas. And so I feel like that should have been covered all along, because that is a big part of this whole scenario. You have to have coverage to from insurance companies to be able to provide the services that are needed. But it has, as Ms. Beard said, it has been a challenge with the elderly, but a lot of them have been able to catch on. It's been a learning and growth curve for everyone. But I'm pleased to see that once they kind of, again, get over the fear of the unknown and try it out for the first time, they find out that they like it. And you're seeing, of course, more increased use of that when it comes to the telehealth during the pandemic. So.
And we've definitely seen an increase in the numbers of patients coming back and getting services. There are some patients who are still reluctant to use technology. Some would just prefer to have a phone call if they can't, for some reason, use the computer. But patients definitely are coming back. And we're beginning to see too, with me being a breast surgeon and we had limited breast imaging for a while, we're beginning to see a lot more patients getting their imaging and having to come in to be evaluated because of new findings that are being found.
So patients are starting to take better care of themselves at this point. I know in the beginning, I would hear conversations about people afraid to go to the hospital or go sit in a waiting room because they didn't want to be too close to other patients. But I have friends now who are saying that they are getting their mammograms and starting to, look at, okay, I need to take care of these physical issues. So that's a good thing. And I'm glad that that's starting to happen. And
it's been a push from us, from providers, to remind people that there are some visits that really you just can't skip. Childhood immunizations, you really need to stay on target with those. Cancer screenings, you really need to stay on task with those. And so it's really been about now coming back and educating patients about continuing their care, how to do it safely, and making sure that our offices are safe when they come. And so the enhanced cleaning, the PPE requirements, mask requirements for patients and for staff. And so because this pandemic, no one knows, when we'll be, clear of it. And so we don't want, especially in community health centers or, in the state, we don't want the health disparities to continue to widen, or get worse because people have not followed through with recommended wellness visits or medications or, annual visits.
Right.
That's a really good point, with the encouragement of patients and individuals to continue with those screenings. And I'm pleased to see that in the healthcare facilities, doctors' offices, urgent cares, and those places, that there's protocols in place to make sure that there's adherence to those type of, to the CDC guidelines for physical distancing and protection, wearing masks. And I'm pleased to see that, everywhere you go now, everybody's wearing their masks for the most part. And when they're coming, to the doctor's office, because there was that apprehension and fear. But now that it's more widespread and common practice, I even as a healthcare provider, when the pandemic first started, for people that I knew, I might have been hesitant about wearing a mask because I'm like, well, this is my friend, this is someone I know. But now, even if it's a friend or a family member, we're wearing a mask around each other. So there's less of a barrier, if you will, for people wearing their masks. They're not afraid they will offend someone by wearing their mask.
And that's a good thing, despite the conversations at the national level that sometimes are still discouraging people from wearing masks, or you see events, large events where people still aren't wearing their masks, which are a little scary to me. I didn't know, Dr. Williams, did you want to add anything to that point?
No, I was just going to say, also initially too, there may have been patients who wouldn't want to wear their mask, but everyone now is on board. They come in, they know it's expected. Everyone wears their mask, and so that's a good thing.
Okay. In your organizations, we've talked a lot about the patients and them coming back, and I'm also curious, have physicians, the healthcare providers also had the worries, those who are parents especially, are they having to work from home more, trying to do more telehealth from home, or how are they managing at this point?
Well, I think not all physicians can actually work from home. And so I think we try to take as many precautions as we can. I'm sure we've all heard the stories of physicians coming home at the end of the day, stripping at the door, leaving their clothing, and taking showers in an effort basically to protect our families. And so I think that we are we're trying to do the best that we can given the situation that we have, and we still need to provide care to patients. And so, and we try to do it judiciously and just try to protect all that are involved, ourselves as well as our families and our patients.
Good. All right.
And not everything can be treated, through telehealth or over the phone. So it is necessary for patients to still come to the office. But what we're seeing is kind of a hybrid where physicians are in the office half the days or a few days a week, and then working from home maybe other days out of the week. Similar to what you're seeing in maybe other industries and work environments. And even in schools where they may come to school in class a few days out of the week and then learning virtually the other day. So yeah, there's still the necessity to see everyone in person. But again, with more education, awareness, knowledge, we're becoming a little bit more comfortable, but still taking the proper precautions.
Okay. All right. So one of the other things that I wondered about, all three of you, well, you are African-American women, and the organizations that you're leading are very diverse. Has there ever been any concerns, challenges to your leadership style in these organizations?
I don't think that there's been any, I guess, challenges to my leadership style per se. It's actually been a blessing to work with the Nashville Academy of Medicine and the staff there and our board members. I think everyone is collegial. We try to listen to each other, respect everyone's ideas. So I haven't actually been challenged on my leadership style that I can see.
All right.
I want to chime in and say that, like, one of the main purposes for Tennessee Women in Medicine, yes, we do network. Yes, we have really great informational seminars on various health topics and topics that affect women in medicine, but also it's for socialization. So, some of our meetings are social meetings. And so I'm not in the type of leadership position where I have to make really hard decisions where my leadership style might come into question. So, our whole purpose is to support one another and network and to provide opportunities where we can meet together, meet, grow, and learn together. So in this particular in other situations, I could see where a leadership style as an African-American woman and maybe even appearing younger. I'm not that young, but just appearing younger, it can be questioned because of, I have a very soft demeanor. But in this, again, organization, it's more for networking and socialization. So.
Yeah, I would say that I haven't felt any challenges, and I will echo what Dr. Williams said, in that I appreciate that my colleagues have embraced my authenticity in the way that I facilitate our board meetings. And so it doesn't take long to know that I'm pretty much a taskmaster, and we just need to get through this agenda. And so, but making sure that board members feel heard, that they've had an opportunity to take in information and ask questions, and to make sure that we are fulfilling our role as directors of the organization. And so, and then I often coin myself as a dinosaur. And so I've known many of my colleagues forever. And so, we've had a working relationship in the past. And so to be the president of the board was really an humbling experience for me, because I was nominated by my colleagues to be president of this association. And so it's not a small task or a thought to think that they thought enough of me to be able to lead during any time, but particularly this time. And so I would say that no, I've not felt any challenges from any of the board members in terms of my leadership style.
Okay, so how have you, when you came in, I think Ms. Beard, you became president in December, is that correct? Okay.
Yes.
And Dr. Williams, I think you also became president in January.
January.
Yeah, and Dr. Hall?
Yes, January of this year.
So all of you started pretty much this year, and your year started out and you're meeting face to face. Is that right?
Yes.
No,
That's
we're
correct.
not.
You're not, but you didn't
Not
start.
now.
Not
Oh,
now.
we started off. Yes.
We started out that way. Yes.
Right. But very quickly it changed to virtual meetings. So how were you able to pivot to make all of that work for your organizations and hold them together?
Well, with Tennessee Women in Medicine, we have an excellent administrative arm that thankfully we actually get to share with Nashville Academy of Medicine. And so our administrative arm is fantastic. They do an awesome job of their job and orchestrating and coordinating for our organization in particular, for Tennessee Women in Medicine. And they kind of took the helm to make sure that we had Zoom platforms, which is the platform we primarily use for our virtual meetings. And even with our like our social or educational events that we hold during the year, to pivot to make those virtual meetings. And so that has been extremely helpful, the administrative arm to Tennessee Women in Medicine. So very thankful for that assistance. And then the willingness of our members to meet virtually. Right. So we had really good correspondence and communication with email invites for different events that we were having.
Okay.
And in addition to that, I want to echo what Dr. Hall said. And in addition to that, just city leaders who were willing to be guest speakers. That was part of the success of us being able to offer these virtual seminars.
So for the Primary Care Association, we are bound by duty to meet quarterly. And so when the pandemic came, it was very clear to all of us that were ripped and torn by the pandemic that we need not meet in person. Let us just meet by Zoom. It's fine. But I will say it was challenging to get that same energy across Zoom that you get in person, getting, all of those motions passed quickly and just kind of keeping the energy up. And, you're talking about a couple of hours long on a call, and it becomes a bit gruesome at times. And so, but I will say that we pivoted pretty
Gruesome
easily.
is a tough word, but okay.
What, the gruesome? Yeah, I mean, you're talking to a room full of people, and it's kind of like this, or a screen full of people, and you're just looking back at you, and it's just like, hello, I know you hear me. I need somebody to say something. And so, but we did pivot pretty easily. And, for our organization, we had events planned towards the end of the year. And so, but again, the board suggested, and we thought about it. And, as we're all healthcare leaders, we don't want to send mixed messages that we think it's okay to get together in large groups. And so we had to, postpone or just cancel events. Our conference this year was virtual. Was well attended, and I think one of the best conferences that we put on. And the administrative team of the Primary Care Association is very astute and excellent in getting all of that technology put in place for us. The one thing I will say, if anybody is listening, we did have about, what specific changes that they may have not considered, is that we needed to make a change to our bylaws to incorporate and to include virtual meetings. And so, who thinks of that? And so now, in this change in environment, organizations have had to go back and reconsider their bylaws and their policies now to include these types of meetings, and what can be done, and how things will be handled in this virtual environment.
And will you be continuing once everything settles down, once there's a vaccine, once it's safe again to meet face to face? How are you thinking about what are the discussions about incorporating virtual meetings into what you used to do face to face?
Sure. I don't think anybody can ever turn back around from where we are now in terms of virtual meetings. They have many advantages. I think the most significant disadvantage is that you can get booked up in a day quickly. You can have a 9 o'clock Zoom, a 10 o'clock Zoom, a 12 o'clock Zoom, a 1 o'clock Zoom, a 3 o'clock Zoom.
Zoom all day long.
A 6 o'clock Zoom. I mean, you can have them just stacked up. You didn't do that, before, because there was just no way, unless you really had my favorite superpower of teleportation, there was no way you could have meetings stacked up in your day like that. And so I think that, but I don't think anybody is going to turn around from this virtual environment now, because there are so many other advantages. And so I only have one more year left as board president, and just in my own reality, I don't know if in 2021 we will be back feeling safe in terms of having large meetings. And so I may not see it under my presidency that we come back together as a group in this.
Is that disappointing to you?
No, not particularly. I think, if I were, Dr. Hall, who our goal was to network and, kind of be together and, have that camaraderie, possibly. But I think, we've gained many efficiencies from our virtual meetings that you can't gather, you can't generate from in person. And so, I'm not necessarily disappointed, and I'm optimistic, I'm hopeful. We'll see each other again in person one day. It may not be as a board, and I may not be the board president. That's, my goal is to just be here to see everyone in person again someday,
Okay. Dr. Hall, you want to respond to that?
Yes, I mean, you kind of get spoiled from the convenience of not having to be way across town, after you've spent a whole full day at work, and then you don't get home till 8 or 9 in the evening because you've gone to meeting after meeting all throughout the week. I would not miss that part. I would be okay with occasional, meeting virtually. But of course, we do with the networking and meeting together for more support, there's nothing that can replace that positive energy that you receive from being around your colleagues and just spending time with them in that fellowship. But, as Ms. Beard said, with 2021, I just don't see that happening anytime soon. where you feel safe enough to meet up in person.
Mhm.
So yeah, I could see it maybe being a hybrid because, again, you like having the flexibility and some freedom in your schedule
Mhm.
feels good.
Mhm. It
The
does.
convenience of,
Yeah.
meeting from home or even working from home. So
The
Yeah,
change.
I think the virtual format sometimes even lends to greater participation
Mhm.
because you don't have to jump in your car and run across
Yeah.
town. And so I think it allows sometimes for greater participation for some of these events. But I think we'll probably see a hybrid. Once we get back to a point where we feel safe enough, I still think that we're going to be utilizing the virtual platform to some extent.
Yeah,
I
I
agree.
think you're right. And Dr. Williams, when you introduced yourself, we're getting some chat, and people wanted to hear a little bit more about you are the first African American to serve as president of the Nashville Academy of Medicine. And so
Yeah.
we wanted to hear what has it been like for you? Is that a ladder that you work your way up to become the president? Why did you decide to become involved with the academy?
So I don't think that, well, it wasn't something that I had on one of my checklists, that I wanted to aspire to become the president of the Nashville Academy of Medicine.
Mhm.
I think for a long time, I've been involved in the community, and that's how I met Katina, Ms. Beard. That's how we met
Yeah.
through, involvement with one of my other organizations, the National Black Leadership Initiative on Cancer. And we used to do outreach programs at Matthew Walker. And I think through all of those different things that I've done in the community, I've just been asked to participate on various boards and did so. And so the Nashville Academy of Medicine, I've been a member for, oh my goodness, I can't even remember when I became a member. It was probably in the early 2000s. And initially served as a delegate a few times. And then Dr. Bob Dimick, who was an orthopedic surgeon who worked with out at Summit, had asked me about my interest, would I be interested in attending the Physician Leadership College through the Tennessee Medical Association. And I said, okay, yes. And the Nashville Academy of Medicine sponsored me to do that. And then from there, I got nominated to be on the board. And then I was approached about being the president. And I was like, really? Huh? I was like, okay. Because that's just not something that I actually saw myself doing. But just honored that I would even be asked to do that. And it's a great privilege. And it's been good. It's been very, very good. It's been good.
Sure. And is your term 2 years also, or 1
No,
year?
my term will be up. In January, I'll actually transition to become the chair of the board for the Nashville Academy of Medicine.
Okay, all right. And Ms. Beard, I think, and correct me if I'm wrong, but you are the first African-American woman to head up the Tennessee Primary Care Association?
I am not actually.
Why not? Okay.
I believe, and I may be misspoken or mistaken, but I believe that our former CEO, Michelle Morris, who Dr. Williams knew well,
Yes.
and I think that's when you became involved with our health center. I believe she
Yes.
was the first African-American woman to be president of the Tennessee Primary Care Association Board.
Okay. And what legacy did she leave that made it easier for you to assume that leadership role?
Yeah, I mean, I think, well, you had to know Michelle Morris to know that her legacy is just, it's in multiple forms. But I think in this one, to make sure that health centers are heard, small and large, in that the diversity of the organization represents the state, and that health centers are required to be diverse in our staff, diverse in our boards, because of the diversity of our patients, and that the Tennessee Primary Care Association needed to also reflect that, and not to be bashful, I think is the word I'll use, not to be bashful in expressing my perspectives or my viewpoints, because everybody's perspective is unique. And I think bringing my perspective as an urban health center, as an African-American, as a person that's been in the kind of system now, for 20 plus years, to bring all of that to the good for the group. And I think, that she did that. I think she brought her all to every conversation for the good of whatever that was at the time.
Okay. And Dr. Hall, I think you are the first African-American woman to chair Tennessee Women in Medicine.
Actually, I want to say Dr. Robin Williams.
I didn't realize that. Okay.
I think she is the first African-American woman to be president of Tennessee Women in Medicine.
Yes.
And the way that I became involved, and to the degree that I'm involved with Tennessee Women in Medicine, was through Dr. Williams. And, it helps having professional networks, but I've known Dr. Williams since our days at Meharry. She was starting as a clinical professor in surgery, and I was matriculating through medical school at the time. We were both younger at that time. So met her way back then, and then, bringing it to present day, she had nominated me to be a member of the board of the Tennessee Women in Medicine, Tennessee Women in Medicine. So I was a board member for a couple of years, but it was some of the board members that had nominated and then elected me to become president. So I'm I believe the second African-American woman behind a great predecessor.
There you go. Well,
yes.
And so all three, this is what you have in common. Is there an opportunity for the three organizations that you all had to work together, or do you already work together?
We already work together. Fortunately, Tennessee Women in Medicine is one of our partners, and then Matthew Walker is also one of our partners through our program called Project Access Nashville, which provides specialty care to patients who are uninsured or underinsured. And so fortunately, we already get to work together. Yeah, so that's great.
Yeah. And I will say that I did not know about Dr. Hall's organization until tonight, but I've already forwarded that information to our providers to say, did you know that this was there? And so hopefully we will start working together very soon.
This
yes.
is good. So I'm glad that you'll start to work even closer together.
Yeah.
One of the things that struck me, I know all of you individually through different ways here in Nashville, but as I got to do a little more research and find out each of you are heading up organizations that of healthcare providers that then take care of patients, thousands of patients in Tennessee. What struck me was this is, I don't know any other place where Black women are collaborating or leading, providing the vision for these organizations as we go forward, and what happens with healthcare. And so I wanted to see if I could get you all to just talk a little bit about what you do see going forward. What are you sharing with your members, or saying that here's some of the things that we need to focus on as we finish out 2020 and start to look forward to 2021?
Yes. Well, with Tennessee Women in Medicine, you know, we when we have meetings, we do with especially with the board members, we discuss the direction for the upcoming year, even the next coming year and next 2 years even. And we look at areas where we want to focus as far as like bringing education and awareness to our members. And one of the big hot topics right now is racial disparities in medicine. And so that's going to be a focus of topics upcoming in 2021. And I'm very pleased that the board members, you know, it was their suggestion, which of course I'm in agreement with as well. And you know, with Tennessee Women in Medicine, a good majority of the members are Caucasian. And so they were saying, you know, with Black Lives Matters, with the political environment, it would be good for healthcare providers to have more understanding of the racial disparities and to just be sensitive to that, even with cultural sensitivity training or topics on that. So that's definitely a focus in 2021.
So racial disparities. So are you talking about what you see in patients? Are you talking about the bringing more physicians of color into into your business, into working with patients, or how?
Yes.
I'm just
well,
curious.
it encompasses a lot of different areas. Health disparities, the disadvantages of African American in particular and other minorities when it comes to the access to healthcare, the being understood from a cultural perspective by other healthcare providers that are of a different ethnic background. So making sure that there's better understanding of cultural differences, cultural similarities, so that there can be more effective communication with patients that you're providing care for that come from a different background. So, but it encompasses a lot of different areas when it comes to, I guess, health disparities and healthcare.
Okay, all right. Dr. Williams, Ms. Beard.
Well, with the Nashville Academy of Medicine, we actually had a strategic planning meeting in the fall of 2019 to focus on our strategic plan for up to the next couple of years. And one of the things that we wanted to do was to cultivate our membership, have a more diverse membership, recruit younger physicians, make certain that we have more hospital-based physicians, and just overall have a more diverse group of physicians. We also want to be able to communicate more effectively, to have more of a city presence, kind of bump up our social media some, so that Nashvillians are aware of the Nashville Academy of Medicine and what we do. We also want to unify the House of Medicine and, you know, basically collaborate more with other organizations, partner with other health-related professions. And then we also want to make certain that we continue our support for the Medical Foundation of Nashville and Project Access Nashville. I love that program, Project Access Nashville. It really is a jewel of a program because it does provide care to those who are uninsured or underinsured, who need specialty care. And so the Nashville Academy of Medicine helps to coordinate that care with a number of the other safety net clinics around the city. So we want to continue to support that. And then, of course, once again, it's going to be our 200th anniversary next year. So we initially had an event planned for October of 2021. I don't know that we'll actually get to do it in person, but we're going to be focusing on activities related to that.
Okay, so the 200th anniversary, which is a big deal.
That's a big deal.
A very big deal, which you'll celebrate, I'm sure, with the city and other agencies as well. And
Yes.
Ms. Beard, what's going on with the Primary Care Association?
So the Tennessee Primary Care Association set its strategic plan, I believe, mid to late 2019. And that strategic plan focuses on the sustainability of the Primary Care Association, but also the sustainability of federally qualified health centers, and that we are making sure that our programs are quality-led, efficient, effective, and meeting the overall requirements of the Health Resources and Services Administration and the Bureau of Primary Health Care, which are overarching funding agencies, but also how we advocate across the state for changes in policy that are important to health centers in order to provide additional access. And so, for example, there was a significant piece of legislation this year that allowed nurse practitioners to be a part of the Suboxone or opioid clinic and to be able to prescribe those medications. Before, it was just held to physicians. And that was a real barrier in some of our health centers that have a significant number of nurse practitioners. And so the Primary Care Association is very focused on making sure that they lead and advocate for changes in policy and legislation that provide support and stability for health centers. The other significant piece of work is making sure that funding is stable for health centers. Many of our health centers, mine included, are 50–60% uninsured. So making sure that our federal funding is stable, making sure that our state funding is stable and that it increases with the increased demand. And so we all know that we'll be seeing an increase in demand of uninsured patients this year because of the pandemic, and making sure that our state partners know that, being aware of the changes in the Medicaid plan and making sure that it contains language that is useful and available, makes it a more accessible program for our patients, for our target population. And so our focus is to make sure that as a state, we are progressing and moving forward in the way that community health centers, federally qualified health centers, provide work and increase access to our uninsured and underinsured populations.
Okay, so there's a lot going on in the next year or so as we continue to move forward, still with these restrictions on us with the pandemic and the CDC, but you know, as long as we're still taking care of patients. And
Yeah.
we're getting close to our closeout time, and I wanted to give you all a chance. One of the things I wanted to ask about, there is an issue maybe coming before the Supreme Court about the Affordable Care Act. Would this affect any of your organizations? How do they see that? Is there any worry, concern about that at all?
Well, I think we're always concerned about patients having access to quality care, and we support patients having access to quality care, and that's one of the reasons that we will continue to support Project Access Nashville, and so that more know about its existence, and that it's there and that it can serve as a gap for those who are uninsured or underinsured. So, so I think all healthcare organizations are actually concerned about that.
Yeah, I agree.
Yeah, I agree as well. We want to make sure that patients that need access to healthcare have it.
Mm-hmm.
You know, I still believe, and many physicians believe in being resourceful and helping patients where they can, because even with, regardless of a healthcare insurance plan, if they have high deductibles and they're still underinsured and they can't afford to pay the costs, you know, a lot of healthcare providers are very sensitive to that. And so they have to be creative to make sure those patients still get the care that they need. So yeah, I agree with Dr. Williams. Definitely all healthcare organizations are making sure that we have a plausible solution and options for the average American that's affordable, truly affordable.
Yeah, I always tell people that, you know, insurance does not always equate to access, and so wherever we are able to improve and enhance benefits for individuals to have access to care, that's what we should push. But before I move from that topic, you know, there's a little bit of unknown or unspoken knowledge right now, and that Sandra is actually a board chairman also. And so I would like to know from her bird's eye view, as being a board chairman during a pandemic, what words of wisdom, what seeds of knowledge do you have for us?
I love that,
Well,
Katina.
thank you, Katina. All right. To be totally transparent, so I am chair of the board of the Matthew Walker Health Center. And it has been one of the questions that I asked of you all. I became chair in February and immediately had to pivot to doing all Zoom meetings, and like everyone, learn how to use the technology. I had never done any Zoom meetings at all. But I think one of the things that I have noticed, we talked about fuller participation. We have had fuller participation from our board members. It has been challenging in terms of fundraising because no one is going to a face-to-face event, but at the same time, we have been able to still attract donations from a generous public that likes to make sure that people are taken care of. These are hard times. There have been people, and one thing I did not mention at the beginning, this in Nashville, the very beginning of March, before the pandemic, was a tornado. And the tornado impacted people as well with where are they living, where are they getting food, and then the very next week it's like they don't have access to health care. So we had to still look at all of those things, but just staying focused on what needs to be done to help patients has been enlightening this year. And you know, we stay focused. Katina, Ms. Beard is the CEO of Matthew Walker, and she keeps us focused on this is what patients need, and the board comes through. So it's been a challenging year. I won't say that. But one thing I wanted to ask you all as we wrap up, what advice, the three of you are very accomplished women at you know, various stages of your careers in healthcare. What advice do you offer to young women who are looking up to you?
I think this is what I heard when I heard, you know, Dr. Hall and Dr. Williams speak about their journey to where they are today. And I think it's true for me. You just do the next right thing. You just do the next work that's there before you because it's important. I think now so many people look or want accolades or a title or, you know, whatever. But for me, you know, you just do the right next piece of work that needs to be done. And then, and God opens doors and creates pathways, and you just keep following that. And eventually you end up, I didn't hear anyone on this call say, you know what, I started off wanting to be president of, you know, no, I don't know who went to sleep thinking that, you know. And so, you know, you just continue to do the work, and then you're honored by your colleagues who believe in you to be able to lead organizations and boards, and you just grow in that. And so, and I've referenced, I don't know, at least 100 times that I am truly honored to be where I am, but I've been doing this work now for 20 plus years. And so it's not an overnight situation that's going to happen, and that you have to be patient, but just keep working.
And I would say to young women that your steps are truly ordered. You know, whatever your heart's desire, your passion, the thing that you find that you like doing most, as you pursue that, and go for that. You know, you will find that you'll make connections, you know, early on in your career or starting out, you know, educationally, and you know, continue to treasure and hold on to those friendships, to those connections, to those mentorships and relationships with professors and teachers, because it will benefit you down the road. I believe, you know, nothing happens, well, all things happen for a reason. And the people that you cross paths with early on, you know, they could be a very strong and vital connection for you down the road. So, you know, be appreciative and don't take for granted the friendships and the connections and the people that you know now, because it can impact you down the road and in the future. And again, just go for your heart's passion, and whatever you desire to do, those resources, they do become available. As Ms. Beard said, you know, the doors open and God makes it available for you to do the thing that you've been called to do. So,
That's
Dr.
right.
Williams?
I would just echo everything that Ms. Beard and Dr. Hall said, and you have to show up. I mean, sometimes you just have to show up and be present, and don't be afraid to do the work. I think sometimes we're afraid of doing some things, and I think I had a conversation with one of my patients today about fear. And then when you do it, you realize it wasn't really that bad, and that it really wasn't that bad, and you were able to make it through. But if you have a goal, go for it, and you never know who's watching you. That's the other thing. You never know who's watching you, and who opens up an opportunity for you. But just embrace it and go for it. And mentorship is really important. I know Ms. Mars was an awesome mentor for Ms. Beard. I mean, I feel like I've known Katina half her life.
You have.
And watched her grow. I mean,
yeah,
and I've watched her grow into this amazing person. And the same thing for Dr. Hall. You know, I was just so thrilled when she said yes to Tennessee Women in Medicine. And I think it's important for us to always be willing to open up an avenue for those who are behind us.
yes.
I think that's really, really, really important. It doesn't really mean anything to get to a certain point if you don't reach back.
Absolutely.
Okay.
Well,
Well,
so I'll leave it there.
all right. Well, I want to thank all three of you for joining the Nashville chapter of the National Association of Black Journalists in our crucial conversations, because this was a crucial conversation. And I think what we've talked about this evening will influence many young people, women, as well as young men. So thank you, Ms. Beard. Thank you, Dr. Hall. Thank you, Dr. Williams. I know that I will be seeing all of you again, hopefully in person one day soon, but if not, we may be having another Zoom conversation. I'm Sandra Long Weaver. I'm a founder of the National Association of Black Journalists, and behind the scenes is our producer, Kanisha Roan, who is president of the Nashville chapter. So I'd like to say good night. Thank you for joining us. Listen for us on a podcast, and I hope you've enjoyed our conversation. Take care, everyone. Stay safe, stay well.
Thank you so much.
thank you.
Thank you.